Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Well, hello. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in nursing school and at the bedside. So we are on episode 2 of the Ask Me Anything series that I'm doing for the summer. And I'm really excited about this episode today. We're going to be covering some questions that come up all the time. So I hope I can provide some valuable insight for you from someone who's not only been through nursing school, but also teaches in a nursing program. Before we hop into that, let's take a quick minute for our listener shout out. And this one goes out to Casey, who says this. Unfortunately, I have to retake MedSurg 1. But this time around, I found Nurse Mo's podcast when I was looking for podcasts for studying on my long drives to and from work. I listened to the episodes on fluids and electrolytes almost nonstop and passed. After the first exam, I bought the MedSurg program and have gone through a bunch of her videos while continuing to listen to her podcasts. And guess what? I'm passing with consistently some of the highest scores. If it weren't for Nurse Mo, I don't know if some of this content would have finally clicked. I recommend this to classmates. This will help you so much. Casey, wow, thank you so much for sharing your amazing story of transformation and how Straight A Nursing is helping you thrive in your MedSurg class. I'm so proud of you for not giving up and sticking to it and coming back strong. All right, ready to dive into this Ask Me Anything? All right, today we're going to be talking about prepping for specialty and advanced classes, what should go in your book bag, the math in nursing school, and the question I probably get asked the most, is it possible to work while in nursing school? So let's start off by diving into prepping for some specialty classes. Now, we talked about this a little bit last week in the Ask Me Anything. Sorry, that was 2 weeks ago in the Ask Me Anything. And the question was about preparing for maternal newborn and pediatrics, which are definitely specialty classes. So I have another question from Timmy asking about preparing for critical care and mental health nursing. So let's first look at critical care nursing. So critical care or your advanced MedSurg class really is going to require a very strong foundation in your MedSurg 1 or your basic MedSurg class. So if you struggled in that class, you're going to struggle a lot in advanced MedSurg. So it's really important that you go back and identify, because what do nurses do? We assess, right? We assess things. So you need to assess yourself and determine what you struggled with specifically. And if there are concepts that you're still just not fully grasping or not really completely understanding, you absolutely must review those and get solid on those concepts. Now, something you can do is you can go back and look through your notes from MedSurg 1, or you can identify what those topics are. Simply come to this podcast and do a search on the website and find episodes that relate to the topics that you're struggling with. And do that review. Right now, if you're listening while this episode is being published, it's summer, you have some time to do some review. So that would be my first bit of advice. Identify where you're weak in basic MedSurg and brush up on those concepts. Okay. And then the next thing that I would really stress that you do is you have to have super rock solid A&P knowledge. So you needed that for MedSurg 1, you're going to need it even more in MedSurg 2. So if you were in MedSurg 1 kind of feeling like, oh, the physiology, I don't really understand, you need to go back to the basics. You've got to go back and review key anatomy and physiology concepts. So things that I recommend students review before critical care are things like blood pressure regulation. What does the body do to maintain blood pressure? Go back and review cardiac output, stroke volume, all those things, right? Peripheral vascular resistance, vasoconstriction, vasodilation, all of those things that contribute to the body maintaining blood pressure. And then with that, a closely related concept that you will use a lot in your critical care clinicals, your critical care med-surg class, is the concept of fluids and fluid shifts. So understanding how all of that works. It's also really helpful to have that blood flow pathway through the heart super dialed in. And when I say through the heart, I mean like through the heart to the lungs and out to the body, basically systemic circulation. Understand that blood flow pathway. You used that knowledge when you learned about right-sided and left-sided heart failure in Med-Surg 1. What's going to be kicked up a notch in Med-Surg 2. So having that basic knowledge will really, really help you. Also, super important to understand things like perfusion, oxygenation, and ventilation. These are core concepts. Also, neurotransmitters, beta adrenergic blockers, and all of those types of things really going to come in handy when you're learning pharmacology and the really, I would say they're kind of like advanced, I was going to say really hardcore, but really advanced critical care type medications such as norepinephrine or phenylephrine and things like that. So neurotransmitters, and also the concept of acid-base balance and how the body maintains acid-base balance. Okay, so that would be key, reviewing A&P concepts. And if you're in my Crucial Concepts bootcamp, I go over a lot of this with you in the module on anatomy and physiology review. So it's all done for you there. Another key thing to do to prepare for critical care is understanding labs and their significance and what disease conditions go with what labs. So if this is something you struggled with in Med-Surg 1, you've got to brush up on this. You absolutely have to. So for example, your patient is in heart failure. What labs are going to be most relevant for a patient in heart failure? Make sure you understand. Make sure you understand why something might be off balance, what you would do about it, and what you might need to watch for in this patient. For example, let's say you have a patient with heart failure and they're taking furosemide, which is a loop diuretic. What labs are really, really important for a patient taking furosemide? That's going to be potassium and creatinine. Potassium, because furosemide causes potassium losses. So the patient could have hypokalemia. And we care about that because its effect on cardiac function, right? And then creatinine is important because furosemide can cause creatinine to increase. So it can actually impair kidney function and damage the kidneys. So you want to be watching that. If that creatinine climbs too high, you're definitely alerting the MD to say, hey, creatinine is at this level today. It was at this level yesterday. They're getting 40 milligrams of Lasix twice a day. Do you want to continue with this and see what they have to say? Sometimes the answer is yes, and sometimes they may adjust things. So you have to know which labs are important for different disease conditions. And also with that, what problems abnormal labs can cause. Okay, so that would be really, really important to know. All right, so that is basically the key for critical care prep. I always tell students, yes, prep work is essential before nursing school starts. That's why I made Crucial Concepts Bootcamp. It's essential between semesters, but I don't want it to take over your life. So I know there's one camp that says, don't do anything, rest, relax, your life's gonna get crazy. And then there's other people who maybe go overboard and do too much. I'm somewhere in the middle, a healthy balance of rest, relax, renew, but also doing some smart prep work. So doing some prep before critical care, you'll thank yourself, I promise. Now, what about preparing for mental health? So mental health is a little bit different because it's not like you learned about mental health when you went through anatomy and physiology, for example. So it's not like you can go back and review A&P and have it help you that much in mental health. Now, it will help you when you're learning about mental health conditions that also affect physiological processes like anorexia nervosa, for example, but it's not going to help you with a lot of mental health nursing. Now, you might get some bad advice about this. Some people might tell you to start reading your mental health textbook ahead of time, start learning about mental health conditions ahead of time. I would not advise trying to learn mental health on your own. That's going to be really boring. A lot of it's not going to stick, and it just does not give you that ability to rest and renew, right? It's fine to review things because it doesn't require as much mental energy, but to try to learn something on your break really isn't the best use of your time. So if you want to get prepared ahead of time for mental health nursing, what I would say is go into this class with all of your systems in place. And I talk about systems a lot in Crucial Concepts Bootcamp. You want to be super organized. You want to have solid study habits in place. All those types of things that set you up for success. Go into it with this framework really solid, and you'll be just fine in mental health nursing. Because mental health nursing is pretty much med-surg nursing, but for the mind, right? So in med-surg, patients have signs and symptoms. You have assessments you need to do, interventions you need to do to solve their problems, and tests and diagnostics that are done. Same thing with mental health nursing. Patients will have signs and symptoms with different mental health conditions. You will have key assessments that you need to perform. You will be intervening to solve their problems. There's tests, there's diagnostics, things that the MD will do to evaluate a patient with a mental health condition. So in that way, it's a lot like med-surg. So while it can be challenging because you are learning a lot of new material, don't get into your head about it being vastly different from med-surg. When students start thinking they have to study in a different way or approach things in a completely different manner just because the subject is a little bit different, they let that anxiety and that fear kind of take over, and then they do struggle with this class. Think of it as mental health being very similar to med-surg in the way that I just mentioned. Basically, you can use the straight A nursing latte method for schizophrenia, just like you would for a patient with pneumonia. And if you haven't been using the straight A nursing latte method, or you don't know what I'm talking about, this is a really focused way to study patient conditions so that you really hone in on the things that you need to know. So if you would like an example of how I use the latte method to go through a mental health condition, then I invite you to check out episode 221, where I talk about bipolar disorder and teach that using the straight A nursing latte method. And then another component of mental health nursing that students do struggle with is psychopharmacology and learning all the medications, because that is a really, really big component of caring for a patient with a mental health condition. So here's my best advice for that. If you need to learn psychopharmacology and your instructor is wanting to know signs and symptoms and all of those things, side effects of medications and safety parameters and all of that stuff, which they probably will, here's what I did. And it's kind of funny, but it worked for me. I made up these super goofy stories about each class of medications and the key things that I needed to know. So here's an example. The benzodiazepines have lots of possible adverse effects or side effects. So I made up a goofy story, and then I incorporated the key things to know about the side effects of benzodiazepines into the story. So I'm going to tell you the story now so you see what I'm talking about. It's kind of goofy, but it absolutely worked for me. So here's the story. Benzo is a clown, and like most clowns, he was very tolerant of small children. So in that sentence, the word tolerant is key, and that's because it's easy to develop a tolerance to benzodiazepines. Though truth be told, the children made Benzo the clown extremely tired. Okay, feeling tired is a side effect of benzodiazepines. One day, Benzo decided to stop seeing the children completely. He said, "I'm done with this headache." Why do I use the word headache? Because headache is a common side effect of benzodiazepines. But once Benzo got home, he realized he missed the kids, and he stayed up all night thinking about them. So, benzodiazepines can cause insomnia when they are stopped abruptly. The next day, Benzo skipped breakfast, which made him feel dizzy, but he didn't care. So, skipping breakfast means that benzodiazepines can cause the patient to have less of an appetite, and dizziness can also be a side effect. Benzo ran so fast to see the kids that he got dizzy, he fell down, he hit his head, and had a seizure. And seizure is the key word there because stopping benzodiazepines abruptly can cause seizures. So there you go. That is how I remembered the side effects of psychopharmacologic medications using some really goofy stories. So that is just another option that you can use if you're struggling with psychopharmacology, because there are a lot of medications for you to know for mental health nursing. Okay, so I hope that helped you understand preparing for those two specialty classes. Now a little bit more of a lighthearted question from Brandy, who says that her first day of school is coming up and she has no idea what to put in her book bag. What supplies are absolutely essential? So what you carry on a day-to-day basis to school really comes down to whether you are a paper person or a digital person. If you're going full on digital, you're not going to have as many things to carry around, right? You'll have your tablet or your laptop, your charger, and that's about it, right? So, but if you are kind of hybrid or a paper person, these are the things that I recommend. So you want to have highlighters. I like to have highlighters in various colors because I like to highlight different types of information in different colored highlighters. So for example, signs and symptoms are one color, medications are another color, nursing interventions are another color. And then my brain gets used to being able to recall that information more easily because it knows that drugs are always orange, or it knows that signs and symptoms are always blue. It just makes it easier to A, find those things when you're looking through your notes, and B, conjure up that image of those words on the page when you're trying to recall that information. So highlighters in various colors, of course, pens, page flags, and tabs are just absolutely one of my favorite school supplies. I use them in my books, my physical books, to flag important things. I use them in my notes to flag important things, to separate topics, all that kind of stuff. Tons of page flags and tabs. A mini hole punch is really helpful if you are getting any kind of paper and you need to hole punch it and put it in a binder. That's super helpful. Also, a mini stapler. Sometimes you have paperwork you need to hand in, or an assignment that you did. Maybe you print it out at school because you don't have a printer at home and you have to turn in a physical copy. I don't know if that's still a thing. I think most things are online, but you never know. So having a mini stapler can be really handy to just staple things together. With that, also a mini staple remover is also a great option to have so that you can take the staples out of things when they're no longer needed. Obviously, a battery for charging your phone, charging your laptop, charging your tablet, whatever electronic devices you are taking with you. I would also recommend a little supply of Tylenol and Advil for those days when you have a headache, or maybe your shoulders and neck are really tight from sitting at your desk all day. And of course, a water bottle. So those are the main things that I would recommend. Post-it notes are also great for jotting things down. So I forgot to mention that, but I definitely think I would add Post-it notes to that list as well. And now that I'm thinking about it, I'm going to say a snack. Having an emergency snack in your bag is a fabulous idea because you may not be able to get to a vending machine or take a break when you need to. So maybe a little bag of almonds in your school bag, just in case you need a little bit of a boost in the middle of a long lecture, a long lab day, or a long study session in the library. Let's take a quick minute for a break. And when we come back, we'll talk about the math in nursing school and that big question, is it possible to work while you're in your program?
Many of us have those stubborn pounds that seem impossible to lose, no matter how good we eat or how hard we work out. My solution is PlushCare. PlushCare is a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. They can prescribe FDA-approved weight loss medications like Wegovy and Zepbound for those who qualify. Plus, they accept most insurance plans. To get started, visit plushcare.com/weightloss. That's plushcare.com/weightloss.
Alrighty, something that strikes fear into the heart of many new nursing students is nursing school math. And they have a lot of questions about what the math is like, what their math skills need to be like in order to pass these classes. So in nursing school, I'd say there's mostly two types of math questions. One's going to be a dosage calculations type question, asking you to determine the proper dosing of a medication. And then another would be what percent formula to feed a baby, for example, or for tube feeding. You're diluting formulas. So those are the two main types of calculations. Mostly you're going to be figuring out dosages of medications. So this math can be really challenging for some students, especially because it's not going to be just a straightforward math question. I always say that the dosage calculations questions in nursing school are not math problems. They're actually little puzzles. So when students try to jump into dosage calculations and view them only as math problems and think that they can just figure out the math and kind of wing it is when they tend to struggle. Because again, they're not really just math problems. They really are little puzzles that represent a moment in time with your patient. But once you understand that, once you know how to set up the problems, it's actually not difficult at all. It's actually kind of fun. I really enjoy doing dosage calculations. And mostly it's just, or actually it is just basic multiplication and division. So when you are looking at the requirements for nursing math and dosage calculations, you will most likely have a test covering math, covering dosage calculations very early on, in most cases every semester. And this is more or less a do or die exam. You will get however many attempts your school allows, maybe 3 attempts to pass this exam with a pretty high grade. In some schools, it's 90%. In others, it's 95%, 98%. I've even seen 100% in some programs. So it's a very high stakes exam. And that's another reason why students get a little bit worked up about it. So my advice for you is to learn how to do dosage calculations before classes start, because I have very rarely ever seen a school teach dosage calculations. They may have an online module or something that you can do to get a little bit of practice, or they might have a book that they recommend that you can utilize to learn to do them on your own. But most likely, they don't have time to devote lecture hours to teaching you dosage calculations. And with everything else that you need to be doing in those first few weeks of school, it's incredibly busy and a huge adjustment. Trying to learn how to do dosage calculations on top of all of that and pass a super high stakes exam is a level of stress that you, my friend, do not need. So that's one other thing when I am talking with students about prepping for nursing school. This is something I say you absolutely do need to spend some time learning. And that is why I teach it in my program, Confident Calculations, which teaches everything you need to know about dosage calculations and those figuring out formula dilutions I also teach it in my prep course, Crucial Concepts Bootcamp. So if you just want to learn dosage calculations, get confident calculations. You'll be great at dosage calculations. But if you want to do more and get a more well-rounded prep for nursing school, then that's when you want to get into Crucial Concepts Bootcamp. So what do dosage calculations questions look like? You might be wondering, well, how hard are these? What are they like? Maybe I can figure this out on my own. So here is an example question. So you have a patient who is receiving an antibiotic that is infused over 30 minutes. The MD has ordered 2 grams of the medication to be mixed with 50 mils normal saline. At what rate will you program the infusion pump in mils per hour in order to infuse this medication? So that's one example of a very common type of dosage calculations question. How about this one? Riley weighs 830 grams and is to receive metoclopramide via NG tube at a dose of 0.15 milligrams per kilogram. The medication comes in a 5 ml bottle containing 5 milligrams of medication. How many mils will the little tiny Riley receive? Rounding to 2 decimal places. So that is another option or another type of dosage calculations question. And let's see, let's give you one more example. Shauna's medication is available in a concentration of 600 milligrams in 20 mils. The order states the patient is to receive a loading dose of 500 milligrams followed by a maintenance dose of 200 milligrams 6 hours later. How many mils will you administer with your maintenance dose? Round to 2 decimal places. Okay, so there you go. Those are some examples of what dosage calculations questions are like. You can see that it's not just asking you to do math, it's giving you a scenario that you have to put yourself into and think through what information you need, how do you set up this problem, etc. So that is what I teach in my Confident Calculations, which is also included inside Crucial Concepts Bootcamp. And that's why I don't think students should be trying to learn this from scratch after they've already started their program, when you are being absolutely bombarded with new information. Save yourself the headaches, save yourself a ton of trouble. Practice ahead of time, pass that exam on the very first try, get it over with, and move on. Okay, our last question, and this is one that I get asked all the time, is it possible to work while in nursing school? So the short answer is yes, anything is possible. And I know for a lot of students, it is absolutely necessary. I will say that most full-time nursing programs discourage students working while in school simply because the nursing school schedule is so intense. So, for example, the program that I went to and currently teach at as a clinical instructor has the students in class, lab, clinical, sim, all that kind of thing, basically Monday through Friday. And so working would be incredibly difficult. Now, are there students who do work while in school? Of course there are. Some students work part-time. A lot of these students work as CNAs, which is a great job to have as a nursing student because you can just get a lot more exposure to working with patients, communicating with other members of the healthcare team, and really honing those CNA skills, which is great. And a lot of times they'll work night shift. So working night shift as a CNA, you can bang out 12 hours. You can bang out 24 hours on the weekend and get a lot of hours in, right? I've even seen some students working full-time. So usually, I would say most of the time, if a student is working full-time, they're working probably as a CNA, doing a 12-hour shifts 3 days a week somehow. Personally, I have no idea how they're managing it. Their school may schedule things differently, so they have some chunks of time to go to work versus having something every single day of the week. So it really does depend on your school and how they schedule things. But even beyond that, even beyond looking at your course schedule, when you need to be in class, when you need to be in lab, when you need to be in clinical, you also have to have time to do your homework and all the assignments. You also have to have time to study. So you have to take that into account. So when I was going into my second semester, there was a student coming into first semester, an older student who had had a full-time job for many years and was doing a career change and worked Monday through Friday, 8 to 5, and was adamant that she was going to continue working full-time, but be a little bit more flexible with the times, because obviously 8 to 5 doesn't work in nursing school if you have to be in lecture from 8 to 11, right? But she was adamant, I'm going to do this. I can do this. I'm going to work full-time. I've worked it around my school schedule. But what she didn't take into account was all the stuff you do outside of class. And there's a lot of stuff that you do outside of class. And I think that situation with her trying to manage that did not last more than a couple of weeks. So you have to look at it from a bigger picture. So I created a calculator that can help you do that. And basically this calculator takes everything into account. How many hours a week are you in class? How many hours a week are you in clinical? How many hours a week do you spend commuting? Because that's time, right? That has to count. How many hours a week are you dedicated to childcare or caring for your parents or whoever, you're caring for other people in a lot of cases. How much time does that take? How much time do you spend on household things like buying groceries, meal planning, cooking meals, cleaning the house, running errands, all of that stuff? How many hours a night do you want to sleep? All of that stuff. How long does it take you to shower and get ready for each day? Everything is in this calculator so that you can just plug in the numbers and see at the end of the day how much time you have each day to spend on other activities. And it's really, really eye-opening. The other thing this calculator does is it helps you determine how much time you should be spending outside of class doing your homework and studying. So for a science class, and nursing is a science, you should be spending 2 to 3 hours per week per credit hour. So that's 2 to 3 hours per week per credit hour. So if you have 15 units in your nursing program, what's 15 times 2? 30 hours a week outside of class, doing class prep work, class homework, and studying. That's at the minimum. In a lot of cases, for some classes, that's going to be 3 hours a week. So that would be, so let's say you had 15 units, you spent 3 hours per credit unit outside of class. That's 45 hours that you need to be spending preparing, doing homework, and studying in order to be successful. So this calculator really, really shines a light on how much time nursing school takes and helps you figure out, okay, I can work, but I can only work 12 hours a week and I'm going to, fit it in here and there. So I recommend that you go and check that out. It is at straightanursingstudent.com/calculator. Okay, so straightanursingstudent.com/calculator. Okay, well, that is the Ask Me Anything for this episode. I hope you found it helpful. I'm doing these every other week for the summer. It's kind of my summer schedule because I am working a ton this summer. And I've got so many questions, a huge backlog of questions from email and social media that I really wanted to take the time to answer them for you on the podcast. So I will see you back here next week for one of our regular episodes, and then a week after that for another Ask Me Anything. Go ahead and send your questions in to team@straightanursingstudent.com, and I look forward to answering your question on a future episode. And if you're a new student heading into nursing school and you're starting to freak out a little bit, that is not my intention with these episodes at all. I do have a lot of things that can support you, and a great place to start is with my free class. It's like a online, like a video, right? A free class/video called How to Thrive in Nursing School Without It Taking Over Your Life. Because that's the goal, right? We want to thrive, we want to succeed, but we don't want it to absolutely suck us dry. And it can happen, right? So I would love for you to get your hands on that. And you can get that at straightanursingstudent.com/thrive. straightanursingstudent.com/thrive. See you next week. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
At a time when change is constant and we are pulled in far too many directions, we need a way to stay present to life and to increase our ability to remain calm, think clearly, and maintain our well-being. Many studies indicate mindfulness improves our mental, emotional, and physical health. On A Mindful Moment with Teresa McKee, you can learn how to practice mindfulness and enjoy its many benefits. Tune in for guided meditations and to hear tips and advice from some of the most respected experts in the fields of mental health and mindfulness. The world truly can be a better place. It all starts with a mindful moment.